I'm Dr. Clare Searle. I'm your menopause specialist GP.
And I'm Sarah Eka, your fitness, nutrition and mindset coach. We're just here in the Club Spirit Lounge talking about a slightly controversial subject through the menopause, which is loss of libido, which I hear from some women, and some women don't really feel comfortable talking about. But it's such a real thing, and I mean that's one of the reasons we created Club Spirit, and we have the Club Spirit Lounge here. So we do have a safe space to talk about it. Would you like to talk about it?
And really, we have to give it a big long name because obviously no one wants to mention sex in the medical world, but we call them the degenerative urinary symptoms of menopause. And so that really covers a few bits really, and libido is one part of it, but one of the one about which really most people will suffer with is vaginal dryness. And often that presents first by people noticing they're getting sore, it feels different down there, and things have changed a little bit. And of course, you don't really fancy having sex if it's not very comfortable to have sex.
No, you don't.
So one of the very first hurdles that we talk about is how to improve moisturisation and how to improve the comfort of having sex, because if it's comfortable, then it is a little bit more possible to have sex. And we have a sort of saying that is the vagina is a use it or lose it organ, and if you're not having sex, then you certainly stop wanting to have sex. So we will talk about that a little bit more, and we're open to that, to having that sort of open dialogue and discussion in this nice safe forum. So we want to talk that through.
And also, it's mood. If we have low mood and kind of anxiety, and obviously and loss of confidence, that must
body
lead,
image,
low body image if you're putting on a bit of menopausal weight. I know it can be really distressing, but presumably that's not going to make you feel sexy either. None of those things. No,
I mean that's of course right, and there's other players in that too. Long-term relationships, relationship changes. There's a lot of change that happens to us at this period of time, and it's about acknowledging that and supporting people through it really.
And communication, I think, is really important to talk to other members here, friends,
and our partners.
Yeah, and our partners. I think it's really important for them to understand what you're going through and how you're feeling, and that it's not, you're not actually rejecting them. I think partners can feel very rejected if you're not in the mood, and they really need to understand why. If you are feeling uncomfortable or not good in yourself, you're just not going to want to. What are there actual physiological changes through the menopause that cause?
Unfortunately,
cause us to have low libido.
The whole of our body has estrogen receptors in it, so that be it from our brains, our breast tissue, and our vaginal tissue. And the vaginal tissue and the tissue up to the bladder has what's called a columnar epithelium, and that is kept puffy, a bit like having fillers by estrogen. And as the estrogen levels fall off, that tissue becomes thinner and shinier and less forgiving with any normal sort of penetrative type of activity. So that unfortunately tends to then give us discomfort. So it is a physiological change and a very real one.
Okay.
And we have to work to reverse it. And funnily enough, whilst there's always the pros and cons around HRT, there's very much less the pros and cons around using topical estrogen, because topical estrogen is incredibly safe, and really there's very few people who are not suitable to use that.
So topical, just to explain, that is something, it's just estrogen in a pessary or something that you would just insert into the vagina, and it doesn't cross into the bloodstream as much, does it? It's a very tiny amount. So if you're worried about kind of HRT,
it's not quite the same, although the packaging says, this is an HRT, which is often why it's underused, that people feel embarrassed to go and try and source any estrogen, and then they don't like it when they get packaging, and they feel uncomfortable talking to someone about what that really means, and often who they are talking to doesn't quite know themselves, so it makes it difficult.
Okay, well, we are here to clear up any questions you have. So remember, we have our monthly Q&A with Dr. Clare. If you have any questions around this topic or any menopause or women's wellness topic, we are here for you. So please ask your questions, chat in the Club Spirit Lounge. Chances are someone else here will be going through, or many people will be going through the same thing as you. You don't have to go through all this alone. This is one of the reasons we started Club Spirit, to help women feel supported and safe and know their options through the menopause.
Absolutely.
Wishing you a happy day, and we'll see you soon.